Oh!
Oh, man, that hook really landed. He knocked out his mouthpiece.
I almost lost mine. You know, my dentures.
Hey, Mike, listen. I found a new way to fix that problem permanently. I feel like I got my life back again.
With FixtTeeth, we create beautiful new teeth and bond them to small implants. FixtTeeth are solid and never come out. Call Dr. Letcher and eliminate your dentures once and for all.
Problems with dentures can be so severe, they can significantly affect your quality of life.
People are so unhappy with their dentures because they don't fit. The denture's fundamental design is flawed. The upper denture utilizes suction, and they'll stay in place. But the lowers, you have to use an adhesive of some sort. Otherwise, the denture literally floats on muscle and soft tissue. A lot of dentists don't want to make dentures because it's so frustrating. Patients keep coming back for adjustments. They make little changes. It feels better for a while. And of course, the conclusion by the dentist is it only took a few adjustments. When in fact, most of your denture wearers just endure.
I lost my front teeth when I was approximately 13 years old. We didn't get to make regular visits to the dentist when we really should have. Being the only girl in the family and going into junior high, my dad said, well, we're gonna get you some new front teeth. So he got me some dentures, and I wore those until I was about 24, 25. That's when I had the struggle with getting them out and putting them in. They just don't fit.
When I got out of dental school, I believed that if you made a good impression of someone's mouth and took very, very, very careful records of how their jaws moved, I could put in the teeth, set the teeth, so that the dentures would be self-stabilizing, so that when you bite down, they don't tip or rock. Well, this is fiction. Mary is what I would consider a relatively successful, for dentures, a relatively successful result. She's been wearing dentures for decades. She has learned to accommodate for the shortcomings. She learns to avoid certain foods.
Carrots. I love carrots, but I don't eat raw carrots because they do hurt. Some cucumbers. But being a farm girl, those are the things I like. So I cook them rather than eating them raw because they are difficult, because if you don't present them just right in your mouth, then here goes the wobble wobble. With dentures, a lot of times you don't really eat food. You sort of push it around in your mouth and then you swallow it. So see, I really haven't got to enjoy any food to its 100% since I was 13.
The material that I use to make FixtTeeth is known in dentistry as a hybrid composite resin. It's the white tooth filling material that a dentist will use to fill a tooth and make it match the natural tooth structure. I didn't fully appreciate myself how beautiful this material can be until I was home working on a ceiling fan, and one of these wrenches that has a spring load to it flipped out of my hand, and this wrench comes down and breaks one of my two front teeth. It's Sunday, I'm seeing patients on Monday, and there is no way I'm going to work with a broken front tooth. On a Sunday afternoon, we repair this tooth. The more I looked at this resin, the harder it was to tell which tooth it was that was broken. And all the reasons that I could traditionally say were the reasons for doing a crown, they evaporated one by one. Why should I do a crown out of porcelain and metal on anyone? And slowly but surely I began to realize this resin was something very, very special.
It took weeks for me to find the right mother of the bride dress. You look wonderful in every picture.
I had a lot to smile about.
Now, haven't we always been honest about how our dentures kept us from really smiling? You look different.
I got rid of my dentures. Changed my life forever.
With FixtTeeth, we create beautiful new teeth and bond them to small implants. FixtTeeth are solid and never come out. Call Dr. Letcher and eliminate your dentures once and for all.
Dental implants have been around for several decades now, but you have to have adequate bone. You have to have a pretty substantial amount of bone, as a matter of fact, for the regular sized dental implants to work. There are a lot of people who do not have adequate bone, nor do they have the additional 6 months required for a bone graft. They are kind of forgotten by the profession. Several of my patients have been to multiple dentists who do implants and have been told they don't have enough bone. In fact, one lady had a jawbone that was less than 7 millimeters high. It's like this. And she was told absolutely she couldn't even have a bone graft and have adequate bone, much less have the standard sized implants. When you use mini implants, they're half the diameter and they are self-tapping. So you don't have to make a hole to put in the mini implants. They self-tap. The moment they're put in, they're instantly in intimate contact with the bone because they tend to compress the bone a little bit. Therefore, you can use them right away. You can actually put teeth on them the day that you put in the implants.
Every time they show anything on TV, well, I'm right there, kind of, looking, wishing, and wanting. But, like I say, I just felt like, that procedure was not for me. But my youngest grandson said something to me that I never really thought about. He said, "Grandma, I want you to have this done because you always put everyone else first. You never think of yourself. And he said, I want you so much to have this." And I never really thought about it that way, but I guess that's what happens with life. And I'm very glad that he told me he felt that way, because no one has ever said that to me before. And it kind of hit in the soft spot.